I have a story for everybody that represents both very good news and very bad news at the exact same time. The Hill says, Democratic senators unveil expanded public option for health insurance. So it's called the Choose Medicare Act. It was introduced by Senator Chris Murphy and Jeff Merkley. And my understanding is that one of them, I'm not sure if it's Murphy or Merkley, actually supports Medicare for All, Bernie Sanders' bill. The other one does not. And then you're getting a bunch of, different Democratic senators hopping on board with this, and some of them not. And this is now we've seen multiple examples of healthcare bills that are not Medicare for All, but they're to the left of Obamacare, that have been proposed by, a plethora of different Democratic senators. And, we're kind of floundering in limbo here in terms of which policy really is going to be the one that the Democratic Party gets on board with and puts all their weight behind. Now, I said this is both very good news and very bad news. Let me break that down. The reason it's very good news is your pressure is working. The pressure of the American people is working. 61% of Americans want Medicare for All. Over 80% of Democrats want Medicare for All. And guess what? You're letting that be known. And Bernie Sanders is busting his ass, getting out there in public as much as possible and bringing up this issue as much as possible to try to raise consciousness and awareness about it, to try to get more people on board. So it's good because this is a direct response to the mounting pressure being put by the public on Washington, D.C. to fix these issues. And by the way, we just covered, I think it was a Gallup poll or a Pew poll. I think it was Gallup from the other week, which found that for, I think it's 4 years or 5 years in a row, healthcare is the number one issue that the American people are concerned about. So it's good because you're putting the pressure on, they're responding to the pressure, and in other words, doing nothing is no longer an option in their minds. So you got them thinking about it, you got them scared. That's how it's good news. It's bad news because it is nothing but a mealy-mouthed, bullshit, centrist, half-measure, pseudo-proposal to try to get you to not think about Medicare for All anymore. And this is what Obamacare was originally. I mean, remember when the original debate happened over Obamacare? For those of you who don't remember the details of that, the Democrats backed single-payer for all of 0.02 seconds. And they were like, oh, hey, we should do healthcare reform. Hey, maybe single-payer. LOL, JK. Let's public option. So Obama went from single-payer to a public option immediately. So he started the negotiation from the center-left position of public option. And then he stayed there for about a week, and then he was like, all right, fine, I'm going to cave all the way to the Heritage Foundation's proposal, Mitt Romney's proposal, Newt Gingrich and Chuck Grassley's former proposals from the 1990s, the individual mandate-style healthcare system, which keeps the structure of the private health insurance companies in control. So that's nothing but a giant cave and going all the way to the right-wing position. But since our healthcare system is so insanely barbaric and shitty, any reform was better than no reform. So we managed to cover more people through the Medicaid expansion, which was a good part of Obamacare, the protections for pre-existing conditions, which are a good part of Obamacare, staying on your parents' health insurance till you're 26, which is another good part of Obamacare. So there's a lot of good provisions in Obamacare, no doubt about that. But it was nothing but a giant half measure. And then see what happens years later after a half measure? This is what happens years later. It's falling apart. And it's falling apart because you left the private insurance companies in control. They don't care about anything but making more money. So they'll jack up the fucking prices and leave certain markets, and then everybody's struggling in terms of affording their health insurance. And so it was a giant clusterfuck because you left the private health insurance companies in control. Well, the Democrats now are going, hey, let's go back to that center-left position as opposed to the center-right position, public option. No, let's not. Let's do Medicare for All now. So it's good because they're responding to our pressure. It's bad because they're factually, objectively, empirically incorrect with their solution. This is like we get out there and we say, hey, let's pull out of Iraq right now. And they go, no, but here's our proposal of reducing the number of troops in Iraq by 80%. It's like, okay, that's better than what we have now, but fuck you, man. Let's get out of Iraq right now. See, this is why the Republican base always turns out to vote for Republicans, because oftentimes they super serve their base. The Democratic base has to fight the Democratic Party, which is why oftentimes the base stays home. So they love to shame you if you're a third-party voter or if you make them earn your vote, and they love to fucking wag their finger at you. But it's not you, it's them, because you're very clear. Hey, do Medicare for all. I'll go vote for you. I'll vote for you. Come out for Medicare for all. I will vote for you if you fucking come out for the things I want you to come out for. They act like they say, no, we're not for the things you're for, but how dare you not vote for me? It's like, no, fuck off. How about that? How about, it's not my fault if you lose. It is your fault if you lose. You're a politician. Go do your thing and get people to want to vote for you. The idea that you flip the responsibility and say like, no, it's on you. No, it's not on me. It's on you. The people didn't fail the politician. The politician failed the people. So you can't keep spitting in the eye of your own base and then get all mad when you don't win elections. They're telling you how to win elections and you're doing everything but that. So, fuck your Choose Medicare Act. Fuck your bullshit half measures. Medicare for all, or that's it. There's some issues where compromise is not on the table. On some issues, we can compromise. You want to have a disagreement over exactly what number the marginal tax rate should be? Fine, that's a reasonable discussion to have, and people are willing to budge. But if you want to have a debate about whether or not we should have a living wage, and I propose, hey, let's do a living wage and tie it to inflation, and your counter proposal is, no, let's not do that, but let's raise the minimum wage to $10 an hour, I'm going to tell you to go fuck yourself. Because that's not a middle ground issue. You can't be half pregnant. You can't be half for not having people live in abject poverty if they work a full-time job. By the same token, I'm done with the half measures on healthcare. I'm done with it. Because what'll happen is you do a half measure, 8 years from now, people will still have massive issues with the cost of their health insurance, and we're still going to be lagging behind the rest of the modern world, and our healthcare will still be way more expensive, and all these problems. And then in 8 years from now, we'll be right back in the same place, having the same stupid debate where the right-wingers say, let's go back to full free market anarchy and fucking screw everybody over, or let's do Medicare for all. So let's just be clear about what the lines are in this debate. The right-wing solution is free market for everybody. Now, that objectively does not work on the issue of healthcare because we have the most free market-like system in the developed world, and we have the worst outcomes objectively. So they're wrong. The answer is Medicare for all, and no amount of mealy-mouthed bullshit half measures is going to override that fact or overcome that fact. People deserve healthcare. When you get sick, you should get help, and you shouldn't have to worry about going bankrupt. You shouldn't have to worry about paying for it. All that money we're wasting on war, all that money we're wasting on Wall Street welfare, all that shit. Forget that. Redivert our tax money to something we all agree it should go towards, healthcare.